Hello, and welcome back to another edition of the End Game Insiders on Your Side, a podcast that was developed for senior lab executives by senior lab executives. My name is Melissa Butterworth, and I am your proud host of the End Game podcast. Today is a very, very special day. Not only are we launching season 2, episode 1, but I've got a very, very special guest today with me. Mr. Robert Michel. Many of you know him from the industry as he is a pioneer. He is someone that I respect greatly. He's the founder of the Dark Report, and he hosts the #1 largest lab conference in the United States, the Executive War College. It is just such a pleasure to have you here with me today, Robert. Welcome.
Well, thank you, Melissa. It's quite an honor to be interviewed by someone of your luminary status.
Oh, you're so kind about that. And, I told Robert this morning when I showed up in my yellow and he had his red, we just look like McDonald's. It just makes you happy. You can't help but be happy, right, Robert? So
that's correct.
Yeah, so I'm so happy, and today's podcast is going to be about assessing the clinical lab industry and the marketplace as a whole. But before we get into today's topic, I always like to share a fun fact about our guests. And a fun fact about Robert is the fact that he is going to be celebrating in about a month his 30-year anniversary of the Dark Report, which I can't believe it. I can't believe it's been 30 years. I shared with Robert this morning that I have been attending the Executive War College now for about 27 years. So I'm so proud to have seen all of your progress, Robert, and I just cannot say enough wonderful things about you. I'd love for you to share with our audience today a little bit about how you came up with the idea of starting the Dark Report and the Executive War College, and a little bit of background about your organization.
Okay, well, that's a fair question. It was back in 1991 when I started working at a large lab company then called Nichols Institute, and I was working out of their Portland, Oregon lab division doing strategic marketing. And this is about the time that HMOs were beginning to reprice services to hospitals, physicians, and laboratories with the HMO Health Maintenance Organization model. And I was able to make some interesting contributions over the next several years. But then MetPath, who you would now know as Quest Diagnostics, acquired Nichols. And that was an opportunity for me to say, there's a lot of things about business, management, marketing, all the money that pathologists and clinical lab managers didn't know. And that was the genesis of the Dark Report. And we started that in September 1995. So we'll have our 30th anniversary here next month. And then the following spring, we initiated our Executive War College on Lab and Pathology Management Conference. And that'll have its 30th anniversary grouping this coming April 2025. So we've been at it for a long time, helping the leaders of labs understand the operational management, financial, marketing, sales implications of how they can keep their labs at the level of clinical excellence in their service mix in a financially sustainable manner.
Yeah, Robert, I think that's such an incredible story. And, I just want to say congratulations. You're such a pioneer and you had the true vision to be able to put this together. I know it certainly helped entrepreneurs like myself, companies that really are looking to network and meet other key executives in the industry. And I noticed that this last year you had a record turnout in New Orleans. I also recognized that there were a lot more hospital executives and folks that I typically hadn't seen in prior years. So I want to congratulate you on that. And for those that are listening to today's podcast, if you've never attended the Executive War College, it is held on the 29th and 30th of April, and that is in New Orleans at the Hyatt Regency. I know that you can get more information about that by going to I guess it's the Executive War College or the Dark Report. If you type that in Google, you'll be able to see the Executive War College come up and the dates for 2025. But cannot say thank you enough, Robert, for starting the organization and for just being such an incredible thought leader in our marketplace. And again, thank you for joining us today. And so, without further ado, why don't we jump right into our podcast today about assessing the clinical laboratory diagnostic space. And perhaps we can start off, Robert, big picture about in the industry. What do you think is really driving some of the changes that we are actually seeing in today's healthcare?
Well, if you look at the healthcare level, say strategically, um, and I'll try and orient this to the interests of the clinical lab, the genetic testing companies, and anatomic pathology. The first one is that hospital and health system finances are under great stress. And probably the most visible sign of this over the last 4, 5, 6 years is mergers between health systems themselves. And one of the more notable for this audience probably is when Kaiser Permanente um, signed an agreement to acquire Geisinger Health. And by the way, that transaction actually has closed in the last 30 to 60 days. And so Kaiser Permanente now owns Geisinger Health. And Kaiser has created something called Risant Health, has put Geisinger in that entity, and expects to be acquiring or being merging with a number of other health systems to go into Risant Health. So health system finances is a big issue, and that affects the clinical laboratory professionals in our audience who are serving their parent hospitals. You know, something else that's going to drive a lot of change, and it doesn't get as much attention as it should, is the federal rule on data transparency and portability. Now, for labs, this is a big deal because every lab is connecting itself to doctors' offices for ordering and resulting, as well as serving parent hospitals and other hospitals. And so the federal rule, there's actually, they've started to fine hospitals that have not been transparent on pricing and have made it difficult to move data. So this is going to be a positive development for labs. It's going to make it easier for labs to access other databases to match their test data with, to help physicians identify patients with care gaps, etc. And then the third thing that's driving change, cybercrime, ransomware, and I don't think I need to say more about the attack on Optum and Change Healthcare here last February that somewhat shut down the majority of pharmacy and prescription ordering for probably 6 or 8 weeks. So those are some high-level things that are shifting in our healthcare system.
Wow, you bring up a really, really great point. I didn't really understand how this cybercrime really affected health systems until I was talking to a chief medical officer, one of the largest healthcare systems in the country, and he shared with me that their system had been taken over by one of these like cybercrime groups, and that they had to pay several $1 million to be able to get their system back. And it just caused all kinds of issues, and it's still causing major issues. So it's pretty scary. I had no idea how significant that could be, but you bring up some really great issues. What do you think, Robert, from the laboratory side of the healthcare business, what do you think some of the pressing issues are right now for lab executives and lab owners?
Well, for decades we've talked about the big one, the earthquake that's going to drop half of California into the Pacific Ocean. So we might equate the FDA final LDT rule as the big earthquake, that hits California. That's going to be huge because a large number of laboratories run LDTs. In some cases, they are using an LDT instead of an FDA cleared IVD test kit, and they've tuned their LDT to match the predicate device. So this isn't about just simply, should we say, novel assays that have been offered as LDTs, but this is also about how labs have run a number of their LDTs in lieu of buying a kit from one of the manufacturers with FDA clearance. So that's the big one. The second one is not a surprise to anyone. It's the acute shortage of lab staff. And whether it's pathologists, clinical laboratory scientists, histotechnologists, the demand for that kind of skill sets exceeds the supply. And I would say another one that presses on labs, payers have no solution yet on how to process all the molecular and genetic test claims that are coming in and do it in a way that's win-win for the patient, the physician, the lab, and the payer, as well as the self-insured employer. And then related to this, it's something that the lab industry collectively needs to sort out, is some of our largest pure play genetic testing corporations have been unable to make money. And we showed a slide in this, Melissa, at the Executive Work College, if you remember, that of about 48 genetic testing companies that had done an IPO since 2015, only 5 of them have a share price above their IPO offering. And so you'll see, I predict some mergers and some bankruptcies. Invitae's bankruptcy, by the way, in the last 60 days is an example. 23andMe is posting huge losses and getting a lot of attention in the investment community. And then something else just to keep on the radar screen, the human microbiome. I can't tell you, every week I can pick up a new study published in a peer-reviewed journal where some group has connected the human microbiome to some kind of disease state that has been intractable at diagnosing and treating. So labs are going to be ground zero for microbiome testing as this continues to spread out.
Yeah, no, you bring up a really, really great point. And when I look at all the genetic companies, it's pretty disheartening because some of them are really, doing some pretty amazing things. And seeing Invitae and the whole bankruptcy, I don't know, I was a big investor of Invitae and really believed in the company. And but so was Kathy Woods, right? And look what happened, right? Look at what happened with it. It's shocking. But I think that was probably a good pickup for LabCorp, right? They're in the process of closing on that now. I think it was probably a good organization for them to pick up.
Well, a comment on this. Invitae filed bankruptcy specifically to liquidate.
Right.
And it had lost something close to $2 billion in about 10 years. And so if you take the statement you just made, Melissa, LabCorp is getting the cherry-picked clients to Invitae that will be the most profitable to LabCorp.
Right. Exactly.
So, yes.
Exactly. That's a really, really good point, but pretty incredible. Well, I know we've seen a lot of move also in the anatomical pathology space. Maybe you can talk a little bit about what's happening in that sector.
Okay. The thing that most people familiar with anatomic pathology overlook is that a cancer case today is much more complex than it was back, say, in 1990. In 1990, the typical surgical pathologist would get a biopsy, prostate biopsy, breast cancer, and it was either A positive or B negative, and that was it. And if you think about it today, with breast cancer, prostate cancer, a whole variety of cancers, doing the biopsy and doing the primary read to say this is cancer just starts the process.
Right.
Now there may be 6 or 8 or 10 additional procedures. This is very true in blood cancer testing. And so the cases are more complex and they take more time. So on the demand side for pathology services, not only is the number of cases of cancer increasing, but the time that is required of a pathologist to diagnose the case is increasing. So that's a factor that the U.S. healthcare system has not yet solved. How do you train enough pathologists so that in the United States we have an adequate supply of pathologists to meet this demand? And it's even worse abroad. So that's going to bring us to things like digital pathology. What's also happening with cancer treatment. So the treatment of a cancer patient has become more complex with a whole mix of multiple prescription drugs, for example. And so pathologists are going to be involved in monitoring the progress of the patient. And all of this is a lot of complexity. And then you've got the conflict if you're going to improve productivity with digital pathology, because the cost to implement digital pathology is not clearly delivering an ROI for a typical community pathology practice yet. And I wanted to make a comment on that. We've been tracking things in the United Kingdom with surgical pathology because they clearly did not have enough pathologists, and people, patients were waiting 6 months for a cancer diagnosis. So they've done digital pathology and they're setting up the networks now, and it's just getting launched. They're about 5 years into this. Here's a very interesting phenomenon I wanted to offer your audience. There's a lot of foreign-born pathologists practicing in the United Kingdom. And one of the people running their digital pathology network nationally was speaking at the War College this year. And she said that one of the benefits of digital pathology is, as these pathologists might have to go back to their native country to take care of ailing parents or deal with family matters, with the digital pathology, they're reading cases wherever they are in the world, so that the UK still is getting some level of productivity out of these pathologists, even when they have to return home for, should we say, family business. And
Wow.
I think that's an interesting comment on the ability of digital pathology as it matures to really help productivity for pathologists.
Yeah, that's a really, really good point. Robert, to your point, we've seen more and more pathology groups that want to invest in digital pathology, but they just don't have the additional resources because their margins have been cut so significantly. So they're looking to either take capital infusion or really divest of their businesses. And we've seen a lot more from an overall year over year percentage of pathology practices selling. And there's a number of buyers out there now that are actually pretty active in purchasing them. So we've seen that quite a bit. And there is definitely a lot of changes in that particular sector. And talking about changes, this whole subject matter of AI, right? I mean, I've got an intern right now who, I give her projects and she flips them back to me like so quickly. I'm like, how did you do that? She's like, oh, chat GPT, AI. And I'm like, what is all this talk about AI, right? But I know that AI is a very, very important subject. And I know that it's going to affect and is affecting the laboratory diagnostic space. So can you talk a little bit about that and what you're seeing?
Yes, we've had several AI experts at the Executive War College over the last 4 or 5 years. And the one message that comes through, which would be relevant for everyone listening to this podcast, is that if you have a limited number of variables, AI is ready for that. And I'll give you an example. Um, LabCorp has this service. There's a number of RCM companies helping labs with this kind of service. At LabCorp, if a patient walks into the PSC, there's a little reader, and they can put their ID card and their insurance card into the reader. And then the reader's going to validate, is this Robert Michel? Has he changed his name? Or, if it's a married woman, did she get divorced? Did she get married, etc.? Is this the correct address of record today compared to what's on the driver's license? It does that whole analysis of, is this really Robert Michel? And then the second thing is, it automatically pings the insurance company to determine, is Robert's insurance active? So the claim I'm going to originate today will be reimbursed. What are his deductibles? Has he met his totals for the year? And how much money should I collect at point of service? That's a good example of AI working right now at one of the national laboratories. The more complicated the issue is, like diagnosing breast cancer, the more complex the challenge for AI, and there's still questions about how, should we say, effective today's generation of AI. And remember, you have to train AI, and so it's the amount of data used to train the AI which is relevant for the AI's accuracy. And some of you probably know Ajit Singh, who sold an early digital pathology company to Roche. Ajit has said that if AI is to replicate the human brain in diagnosing breast cancer, you need to train it with 5 billion cases of breast cancer.
Wow.
Now, whether that's going to happen or not, but the point is, the human brain has millions of years of evolution. and you have to train AI with data. So how do you get that volume of data to make the AI comparable to the human brain? Pretty interesting, isn't it, Melissa?
I mean, it's fascinating. Yes, it really is fascinating.
Yeah. So what you're seeing now with AI in terms of diagnostics, a lot of labs are picking up workflow solutions. So that it's an AI thing. It's an AI solution driving workflow, identifying which instruments are more productive, even which med techs standing in front of an instrument are more productive than their peers. And then when you get into pathology and using AI, what do I like to say, AI powered image analysis algorithms, those things are on a rapid ramp up. And there's companies like Ibex Diagnostics, Ibex Health Solutions out of Israel that has its solutions in a number of labs. And Gestalt Diagnostics has got workflow solutions in a number of major labs. So it's happening.
Wow. It's pretty incredible. I mean, it's really, really incredible. Well, of all people to, you're such a pioneer and I have so much respect for you, Robert, and what you've created. And I think you're really also a true visionary. You've seen things way before they happen. And so that brings me to like my next and final question for you. If you could predict like what the lab industry is going to look like in the future, like what do you think is next for the lab industry? What are your predictions?
Well, fee for service is going away. It's widely recognized by both providers as well as payers and healthcare policymakers that a fee for service claim encourages medically unnecessary procedures as well as outright fraud. And so paying on what we commonly call value-based reimbursement models is what's coming. And if you look at that, Medicare Advantage is the one clinical labs should study, because in Medicare Advantage, there is risk adjusted premiums to the health insurer and to the providers. So if Robert's a healthy senior, and I'll make up some numbers, Medicare may be paying a $5,000 a year for Robert. But if the health plan and the physician can show Robert is an adult diabetic, that $5,000 may increase to $6,000. And if they can add a diagnosis of chronic kidney disease, CKD, maybe that goes to $7,000. And so Medicare Advantage is showing the model for value-based care that is rewarding both the health plan and the provider for diagnosing undiagnosed conditions and then managing those conditions to minimize the downstream consequences.
Wow. How do you feel about that? I'm curious. I mean, do you think that's the right way to be going?
Yes, definitely. And guess what? This is the keys to the castle for labs. Labs know where there's care gaps. If there's an ICD-10 diagnosis of adult diabetes, and the lab can see that in this doctor's population, there's 30 patients who have not had an A1C test in 2 years, that's an opportunity for the lab to step up and help the doctor and the payer close the care gap. Um, think about chronic kidney disease, and creatinine is one of the measures. If you had a patient who for several years, the creatinine, I think the range, let's say, is 2 to 5, was at 2. And then in the last 18 months, the creatinine tests as they've gone in for their physicals has gone from 2 to 2.25 to 2.75 to 3. That's a trend before it reaches an acute level that the lab can flag the doctor and say, hey, you probably want to intervene. And then you may prevent the chronic condition of CKD. So this is how labs have a great ability to be adding value. And I believe that smart labs should be talking to the larger self-insured employers in their service area, because the health benefits manager at this corporation wants to have the best care for their employees at the least cost. And they don't know what lab tests would make a difference. And it's the health plans in between the self-insured payer and the providers that sets the policies on what gets covered and what does not.
No, absolutely. Wow. Well, you know what, Robert, you're just such a wealth of information, and the fact that you would agree to come and be on today's podcast and share a portion of that. I know, you and I both have been in the industry for a long time. It's super exciting to see all of these things happen in our industry, and it's just such a pleasure to have you here today. For those people that are just tuning in today, if you would like to see a copy of this podcast, we do put them on our website at www.advancedstrategicpartners.com. We also put them on Apple, Spotify, and you can find them now on YouTube. And if you want to get a hold of Robert, what's the best way to get a hold of you in the future?
Oh, you can go to www.darkreport.com and you can get your copies of the Dark Report, which is the premier business intelligence service for our laboratory professionals. The Executive War College Conference has a website, which is www.executivewarcollege.com. And we're glad to help anybody that wants to reach out to us for information and resources and insights.
Thank you so much, Robert. And thank you again for joining us. And to our audience, I am super excited that you joined in today. And I'm looking forward to our next podcast in 2 weeks. Signing off as your host.